Back pain treatment NYC case history. Real patient with real doctor. Episode 1.
Hi.
Okay, Lori, you have an appointment today with Dr. Malani, right?
Yes.
Okay. We need this to fill out for us. Can I have your insurance card and your ID?
Absolutely.
Thank you. You can have a seat right over here in our waiting area, okay? I'll be
Okay.
there.
Thank you.
Thank you. Hi. Good. Do you have an appointment today?
Hi Lori, how are you?
I'm good.
Alright.
Sort of. In a little
So-
pain.
Please tell me what's troubling you.
So, I had a kind of increasingly lower back pain, like over the last year and a half. But it travels. It seems like a kind of a sciatica pain that goes in my leg. It can be on this side, then it'll go to this side.
Was there any particular trauma or injury that started it?
Not at all. I know actually, it was good for almost a month. I got some insoles for my shoes, and it helped for about a month. And then I was trying to do some installation at home with something, and I kind of twisted my body around, and then it
Alright.
was bad.
Have you had any imaging of your back? Any x-ray, any MRIs?
No.
Okay. Now, show me the path the pain takes down the leg. Where does the pain go?
It goes, when it goes down the leg, it goes along here to here.
Okay. Does it go past the knee?
Usually not. Every once in a while there's a little knee ache, but then
Does it go lower than the knee?
no,
Okay.
no.
Any tingling, presentable sensation or numbness in the legs or the feet?
No, not at all. I do get, I get muscle cramping, but it's totally separate from that.
Okay, where's the cramps?
In my calves,
Both sides or just one side?
both sides,
Okay.
pretty equal.
Does the pain ever go down the other leg or no?
Almost never. It might happen once but I don't remember it really doing that.
And what position is worse? Sitting, standing, walking, laying down? What makes it worse?
Sitting is the worst.
And what makes it feel better?
Usually walking. While I'm walking, it feels better. But you know, it's not consistent in actual fact.
Alright. Comes and goes and different things aggravate.
Different things, exactly.
Okay. Alright.
It's weird.
Okay. Any medical problems?
Never.
Any surgery and hospitalizations?
Cesarean is the only surgery I run.
Any medications taking anything over the counter or by prescription?
No, nothing.
Alright. And most of the time, what do? Are you sitting behind a desk and computer? Are you up and around, walking around? What is your work job involved, basically?
Mostly sitting, but I try to get up quite a bit because I work from home, so I'm constantly getting up so that I'm not sitting too long. I do counseling at night, so that involves more of a steady sitting thing, like for 2 hours at a shot.
Okay. Is it uncomfortable by the end of that period?
Yes.
Okay. Alright, let's take a look. And again, point to the back where it hurts. Where do you get the pain?
Right now it's here,
Okay.
but sometimes it'll be over here.
Alright. And what's the path that takes down the leg?
Like there,
Okay.
or like that, like somewhere on that side, yeah.
Okay. Take a step back, half a step back. And now with your knees straight. How far can you bend forward? Touch your toes, but stop if you get pain. Don't go if it hurts. Okay. Then come on back up. Bend backwards as far as you can. Alright. to your right side and to your left side. Any pain with those?
Yeah.
Where do you feel it? Right in the same area?
Here. Yeah.
Okay. Come on up here, have a seat.
That's why it's like hard to describe it. It travels, but
Sure, sure. Any pain with this?
No.
Does this cause anything?
No.
Good. How about this? Any pain? Does this cause anything?
No.
Good. Lie down face up, please.
Face up.
Alright. Relax your legs. Any pain with this?
Yeah. Yeah.
That's the pain. Okay, now, if I do this, does that aggravate it in any way?
No, I just feel pulling my calf muscle, but not
Okay.
anything.
Any pain this way? This way? Any pain this way?
No, it kind of more relieves it pretty much.
Okay. Any pain with this? That's okay.
Not so much.
This way, this way.
Slight, when you go to the right, then I feel a pull right there. I
That's
feel it.
If I do this, does that affect anything?
Yeah.
Okay. And then this goes here. Any pain with that?
Nope.
Alright, good. Let me have your glasses, please. Alright, turn around, lie on your stomach. Alright, you want to rest your forehead on your hands. Good. Any pain in this area?
Not really.
Anything by pressing in here?
No.
Anything along here?
No. It's
So
really
nothing
just-
localized. It's the pain you're feeling, I'm not reproducing by pressing, correct?
Right.
Okay, it's a deeper pain.
It's just a travel. It's mainly a traveling pain. That's all I can
Okay.
say.
Any pain with this?
No.
Any pain with this?
I can feel a slight. It's just very, very slight when you do it. It's, again, it seems to be somewhere in there, but
Okay.
not pressure on there doesn't seem to affect it.
Alright, very good. Okay, good. Go ahead and come on up. What you have is commonly called sciatica,
Right.
which means really pinched nerve in the back.
Right.
And that pinched nerve is typically coming from disc issues. Let me show you what I mean.
Yeah.
This is the spine, this is the front of it, this is the back of it.
Yeah.
The brain sits here, so there's a spinal cord through there. As it goes down, it gives off these nerves. Nerves in the neck travel down the arm. Nerves in the lower back travel down the leg.
Okay.
Spine itself is made up of bones and these discs.
Right.
The discs are like jelly donuts. When the jelly comes out, it looks like this. Or sometimes if they're degenerated or worn out,
Yeah.
it actually compressed, and this one there's less space for the nerve, so the nerve gets compressed.
Right.
What we're going to do to treat this is initially start you off with physical therapy, which involves a few things. It involves some modalities like electric stimulation. It helps to relax the muscles and increase blood flow. It also includes massage or hands-on training. It also includes certain specific lumbar sacral stabilization exercises. What they do is that we try to support the back better, so it takes the pressure off these areas. Most likely what you have is a disc which is herniated like this, or bulged, or worn out or degenerated. And that's going to press on or irritate the nerve. And as you condition the muscles around the spine and improve the posture there, you should be able to take the pressure off the nerve and be able to make it feel much better. That's the first thing.
Right.
I would also like to run an MRI for you, since this has been going on for quite a long time. This will help to confirm everything I'm saying as far as it is.
Right.
And if so, then there's some other treatments available as well.
Okay. That sounds promising.
Alright, any questions?
Well, if the disc is worn down, like I'm obviously not in my 20s, 30s, if it's worn down, is there any regenerative kind of thing that can happen?
Sure, absolutely. There's a lot that we can do, and we'll discuss it more once we get the MRI and we see what we have. But the ideal treatment for it would be spinal decompression, but non-surgical spinal decompression, which basically means traction at an angle to target a specific disc, which is going to take the pressure out of that disc. But let's get the MRI. We'll look at the results of that a little more specific.
Okay.
Okay.
Okay, good.
All right. Okay.
Click the link to watch what happens next. Leave your comments below.